Good afternoon, everyone. I'm so happy to be here. I'm Dr. Allison Arwady, the Commissioner at the Chicago Department of Public Health, and we are here today joining the Chicago Department of Family and Support Services, Lawndale Christian Health Center, and Pacific Garden Mission. We're here really celebrating the fact that a lot of people are getting their second doses of COVID vaccine. It's a great day here. I love going to vaccination events in general across the city, but this one especially makes me happy. Just recognizing that everybody here has worked hard to make sure that people who are experiencing homelessness, not just at the time of the COVID vaccine, but really throughout this outbreak, have been prioritized. We know that there are more risks, and we've worked hard, and you're going to hear from all of these partners up here some more about that work. So just to introduce the people who will be speaking briefly today, we have Maura McCulley, who is the Department of Family and Support Services Deputy Commissioner for Homeless Services. We have Mary Tornabene, the nurse practitioner from Heartland Alliance Health. I neglected to mention Heartland Alliance, apologies. We have Dr. Alex Port, a family physician from Lawndale Christian Health Center. We have Constance Foster, a resident at Pacific Garden Mission. And we have Dr. Geraldine Luna at the Chicago Department of Public Health. So I will just very briefly set the high level that we are doing really, really well here in Chicago from both a COVID perspective and a vaccination perspective. As of today, we have the lowest percent positivity that Chicago has seen since COVID arrived in Chicago. Yes, let's. So we are at a 3.2% test positivity for our average over the last 70 days. We're averaging just 257 new cases per day. That's been dropping day after day as well. Our emergency department visits, our hospital visits, everything is heading the right direction. And thank you to everybody who has continued to wear your mask, social distance, do the things that have gotten us this far. Similarly, our vaccination efforts going really well. We have had more than 500,000 COVID vaccine doses administered just here in the city of Chicago. We have 1 in 9 Chicago residents who have now gotten at least that first dose of vaccine, 1 in 4 Chicago residents over 65. We continue to meet all of our goals related to having a very efficient vaccine rollout every single week. 95% of our vaccine or more is getting pushed out to providers. More than 90% is in arms and reported less than 7 days later. And we've been meeting some more of our equity goals. Last week, more than half of the doses for Chicago residents went to Black and Latinx Chicago residents. And when we know that those groups have been particularly hard hit by COVID, we're proud of that. But today is really celebrating a lot of the approach that so many partners have had here in Chicago to prioritizing folks who are experiencing homelessness. We've done a lot of things here that are unique in Chicago across the country, and we want people experiencing homelessness to know that they are a priority for the city and their health matters. So in that context, really pleased to bring up Maura McCulley, the Department of Family and Support Services Deputy Commissioner for Homeless Services.
Thank you, Commissioner Arwady. Good afternoon. My name is Maura McCulley, and I serve as the Deputy Commissioner for the Homeless Services and Domestic Violence Services at the Chicago Department of Family and Support Services. I really want to thank Pacific Garden Mission for hosting us today in this really exciting event. DFSS plays a key role in managing homeless services in Chicago and is the city's primary funder of shelter beds. Currently, DFSS funds over 3,000 beds at 50 shelter facilities operated by 29 different service providers. DFSS also coordinates citywide shelter referrals and placements. Last year, more than 36,000 residents accessed homeless services in Chicago as we rapidly realigned operations in response to COVID-19 pandemic. We have worked closely with the Chicago Department of Public Health, the Chicago Continuum of Care, shelter and street outreach providers, and more to ensure an equitable, compassionate response to COVID-19 for all residents experiencing homelessness. DFSS, in partnership with the Mayor's Office, quickly set up an alternate shelter network to accommodate nearly 700 shelter beds as shelter providers citywide decompressed and adjusted their facilities to practice social distancing. This alternate shelter network helped us to minimize the loss of shelter beds as shelter providers focused on the safety and wellness of their clients. I'd like to thank Commissioner Arwady and the team at CDPH, in addition to medical partners like Lawndale Christian and Heartland Alliance, and a whole slew of medical providers out there who have been behind the scenes advocating and really working diligently with our shelter providers who have been on the front lines, and our street outreach providers who have also been on the front lines working diligently to mitigate the spread of COVID-19 among sheltered and unsheltered residents in Chicago. Because of their service and their dedication, the city continues to provide residents who are vulnerable with healthcare resources, from isolation services to testing and now the vaccine. It has been a really long road, and hearing statistics that were just shared is really gives me hope, and I hope it gives all of our partners and our residents hope as well. As we continue to build on this work, DFSS is also dedicated to the housing first model and transitioning residents experiencing homelessness into permanent housing more rapidly, because we know that housing is health. Our expedited housing initiative does just that by helping to remove barriers that can impede rapid placement of residents into available rental units. To date, more than 400 residents have applied for housing through the initiative, residents who are experiencing homelessness, including more than 60 residents that have lived in encampments. In the next year, we aim to house more than 2,000 additional households. So again, thank you to all of the city departments, delegates, community organizations who have been on the front lines, and all of the medical partners and other community partners who continue to make the health and safety of residents experiencing homelessness a top priority. Information on all homeless and other family and support services, including requests for shelter, is available by calling 311 or visiting chicago.gov/FSS. I would now like to introduce Mary Tornabene from Heartland Alliance Health.
Thank you, Deputy Commissioner, and everyone, for inviting me here today. For 30 years, Heartland Alliance Health has been dedicated to bringing healthcare to Chicagoans experiencing homelessness, meeting people exactly where they are, and providing the care they seek. In the time of COVID-19, that patient-centered care includes reducing barriers that create inequities in access to the vaccine. In this work, relationships come first. Thanks to the Chicago Department of Public Health's leadership, guidance, and support, our shelter-based service teams have been given the resources and time to build trust with shelters across the city and with individuals experiencing homelessness, therefore increasing vaccination rates. The targeted proactive campaign began weeks before most other cities, and Chicago is the largest city in the country where this effort has been happening. As chair of the Healthcare for the Homeless Clinicians Network Steering Committee, I can say this: Chicago's whole shelter vaccination plan is what all HCH agencies across the country are advocating for. Additionally, Chicago is addressing health equity and structural barriers to care by aligning every homeless shelter with not only vaccine, but with a full suite of healthcare for the homeless services. This includes primary care, behavioral health care, treatment for substance use disorder, benefits enrollment, and coordinated entry housing access. This is the gold standard that cities across the country have been trying to achieve for decades. I can't stress enough how remarkable this is, especially during the time of a pandemic. While this campaign is about reducing the contraction and spread of COVID-19 in homeless populations, its impacts will be transformative far after the pandemic. Ultimately, this work will help us further address the greatest health disparity individuals experiencing homelessness have, and that's housing. Much of Chicago's COVID-19 response in this population has been centered around housing, and we have seen the impact that a set of keys has on the health of people we serve. Our city has come together in a new and in a unique way to respond to this crisis and helping people out of homelessness and into health. Thank you. I'd like to introduce Dr. Alex Port, family physician at Lawndale Christian Health Center and the site medical director here at Pacific Garden.
Good afternoon, everyone. My name is Dr. Alex Port, and I'm a family medicine doctor here at Lawndale Christian Health Center and the site director here at Pacific Garden Mission. We're here today to talk about health equity, about bringing precious vaccines right to people experiencing homelessness and to our Black and brown communities who've been hit hardest by COVID-19. Bringing the coronavirus vaccine to PGM and other shelters is just part of the picture. As a family doctor, I'm blessed to be part of a team that sees people at PGM for their ongoing medical needs. One of my joys is getting to know people over the long term, to work with them on their ongoing medical needs and to achieve their goals. It's a blessing to see my patients for their high blood pressure, their diabetes, their mental health, and then administer their vaccine, and then work with PGM staff and other partners to work towards permanent supportive housing. This is the work we've been doing here in Chicago and will continue to work every day in the future to address the racial and social inequities in healthcare and housing. It was just 10 months ago that we, with the city's great support, started to shield 259 high-risk persons experiencing homelessness from coronavirus at Hotel 166, many of them from PGM. More than half of those at the hotel achieved supportive housing. We believe that housing is healthcare, and we need to find more supportive housing for our brothers and sisters. They need to know that the healthcare and housing systems will deliver for them in the future. Here at PGM, we have vaccinated 180 PGM guests and staff, and we continue to vaccinate today, 56% who are Black. So far, we have a 42% coverage rate. We will be giving the second dose of the vaccine today, and of course, offering the first dose to anybody who would like it today. We are so grateful to CDPH for providing these vaccines, prioritizing people experiencing homelessness, and prioritizing people in Black and brown communities. Thank you. Now, I have the opportunity to introduce our next speaker. She's a patient of mine and a guest here. Her name is Constance Foster.
Good afternoon. My name is Constance Foster. I'm so pleased to be receiving my second dose of the COVID vaccine today. I received my first shot a few weeks ago here at Pacific Garden Mission. I first learned about the opportunity to receive the vaccine from Dr. Port and Dr. Metra. I had some questions about it, and they answered them, so I felt comfortable taking the shot. I chose to take the vaccine because I want to protect myself from COVID. I actually had COVID in March of last year, but I was very lucky that it was a mild case. But I know COVID can be very serious disease, leading to hospitalization and long-term health consequences. I decided that for me, it is better to be safe than sorry. The future of COVID is uncertain. With the new variants emerging, which is all the more reason I want to be safe. By taking the vaccine today, I want to protect myself from getting COVID again. Now that I have been vaccinated, I feel safer, yes. I want to thank the doctors and staff for offering the vaccination to me. Thank you. The next speaker is Dr. Luna from the Chicago Department of Public Health. Thank you.
Good afternoon, everyone. Y buenas tardes a todos. I will be doing my remarks in Spanish. Hoy estamos aquí para celebrar, número uno, que los casos de seropositividad aquí en Chicago han bajado a 3.2% desde el repunte. Estos son excelentes noticias. Y los casos coinciden con estos números, siendo cerca de los 100. Chicago continúa poniendo su pie adelante. Chicago es líder a nivel nacional en vacunación de personas sin hogar. Durante la pandemia, Chicago se ha centrado en apoyar a los más vulnerables con respecto a las pruebas, alojamiento y ahora con las vacunas. El alcance comunitario y las colaboraciones como estas que están sucediendo aquí hoy demuestran que la equidad es el plan de vacunación de Chicago. Todo lo hemos hecho basado en el cuadro de la equidad. Desde el principio de la pandemia, la ciudad se comprometió a que la salud y la seguridad de aquellos sin hogar fueran la prioridad absoluta. Chicago ha priorizado a las personas sin hogar y al personal que los atiende, no solo porque es lo correcto, sino porque estas personas son de las más afectadas por el virus y a menudo son los que menos tienen acceso al cuidado médico. Por esta razón se han administrado más de 2.200 dosis, primeras dosis, en albergues y siguen aumentando. Desde hace tiempo, London Christian Health Center y Heartland Alliance Health tienen relaciones con estos refugiados y presentan la mayor cantidad del cuidado médico brindado para nuestros habitantes que se encuentran sin hogar. Estas relaciones de confianza ayudaron a establecer rápidamente un programa de vacunación contra el COVID-19 con dosis de vacunas comprometidas por la ciudad para vacunar de manera eficiente a las personas en refugios y superar cualquier duda y barreras a su vacunación. Londale Christian Health Center y Heartland Alliance Health, en asociación con la ciudad, buscan abordar las inequidades de salud históricas que enfrentan nuestros habitantes sin hogar. Aún así, es importante recordar que este esfuerzo, aún después del COVID-19, seguirá en pie. Gracias.
Thank you, and really, I love hearing all the different perspectives, and particularly the passion of the group that are working here to think about how we take what we're doing with COVID and make it something that lasts, make it something that makes a stronger system really for everyone. So with that, we're happy to take questions for me or really for anyone who is up here.
Hi, Commissioner. Marie Saavedra with CBS 2. Thank you for your time. I want to start by asking about the Belmont-Cragen neighborhood. You've talked about how important it is to respond down there as part of the Protect Chicago Plus program. We saw a flyer that said that there's a specific area, specific zip code, that if you are 18 and over and live in that zip code, you can get the vaccine. And as we understand it, it's just 18 and older, no 1A, 1B, just 18 and up and in that area. Can you confirm that's happening and talk about why it's happening in targeted neighborhoods like this one?
Sure. So first of all, we have a lot of strategies, as you know, related to really making sure that vaccine is distributed equitably across Chicago. And if you've looked at our maps related to vaccine uptake, you've seen that there are parts of the city that are under-vaccinated already compared to some of the others. And so we've used, we use something called the COVID Vulnerability Index, where we've ranked really all of the community areas in Chicago, and we use that ranking for every decision that we make. So when we're thinking about which providers we distribute vaccine to first, when we're thinking about how we prioritize neighborhoods, we use that group. The 15 community areas that really are the highest vulnerability there for COVID are what we call our Protect Chicago Plus communities. These are the communities that really have been hit hardest by COVID, have the most barriers to vaccination, things like not a lot of primary care, not a lot of insurance, a lot of underlying conditions. And our goal in those settings is to make sure that we can continue to direct vaccine there until we see those communities at vaccination rates that are at or above the city average for vaccine. And so in that context, there is a meeting, a couple of weeks actually of planning with community leaders in each of those community areas to say, what do you need in your community to be able to help get these vaccine rates up? And so we do not stick strictly to those phases. If people in these communities say to us, it's really intergenerational households that are driving our biggest concern, or say there are settings that maybe have not been defined within 1B, and they say, these are the kinds of work settings that we have more concern, we allow vaccine to be administered really in the way that those community leaders allow it. And so we follow along, certainly, what the vaccination rates look like, and we will continue to provide vaccine while we continue to see those neighborhoods be able to catch up to what we're seeing across the rest of the city.
What would your response be to someone who is 65 plus and struggling to get their own vaccine who hears something like that?
Sure. So, people 65 plus are, within the Protect Chicago Plus communities are prioritized there, of course. We continue to say first, go for the folks who are highest risk. But outside of the Protect Chicago Plus communities, what I would say is that one of the reasons why we are seeing the best positivity, the best case rates, the best progress against COVID yet, some of that has to do with how we've already made some decisions about directing vaccine. And when we are making vaccine available to the settings that are highest risk here in Chicago, certainly that includes settings like long-term care facilities or homeless shelters like we're at, where we've disproportionately seen a lot of cases. We know it's hard to always have all of the distancing and all of those things in place. These are individual settings that have really driven our COVID outbreak here, and getting vaccine into those settings already is starting to have an impact related to cases. That is just as true at the community level. These community areas that have been hard hit by COVID and are currently under-vaccinated compared to the rest of the city are the settings where the risk of COVID remains highest. And every time that we see additional cases diagnosed, that raises, as Constance said, more concern for variants. So our strategy, an equity strategy, is not just because it's the right thing to do, but because getting a higher, an equitable amount of vaccine into our hardest hit areas in Chicago in turn helps protect everybody in Chicago. So it's the right public health strategy as well.
There's been a bit of a relaxing in travel policy for the city. What do you say to Chicagoans who feel like this might be a green light for them to start traveling?
Yeah, so let me clarify. We actually have not relaxed anything related to the guidelines on travel. We've been using the exact same metrics going all the way back to when the travel order was put in place. But we have seen a lot of improvement across the country, and so we've seen a lot of states. We've got 18 states, I believe now, as well as 2, Puerto Rico and DC, that are no longer on that orange level travel list. We also did add, and this may be what the reference is, following CDC guidance, that when people are fully vaccinated, meaning 2 weeks post their last vaccine dose, so their second vaccine dose for currently available vaccines, as long as they're not having any symptoms, they do not need to follow that quarantine and testing that is required for folks who travel. So it is definitely not a green light to travel. I want to highlight that we continue to really, most states are still under that travel, all the states are under the travel order where we're recommending caution with traveling and trying to avoid non-essential travel. But we are seeing major progress here in Chicago and across the country. And we are really set on making sure that when we set these metrics, we're responsive to them. So as states are coming under control from COVID, just as Chicago is here, the risk does go down related to travel, and our guidance will continue to evolve related to that.
I had some questions from WBEZ, ABC7, and Block Club. They were asking that while the COVID vaccine is free, there are some other clinics or private clinics that might be charging upwards of $195, $200 for some sort of administrative fee or some kind of fee to get the vaccine. They are wondering what CDPH can do about this. Do you have authority to stop the fees or minimize the fees? Any involvement or crackdown on this issue?
Yeah, so we're certainly aware of it, and there've been a lot of conversations happening. So just to clarify for everybody, nobody is allowed to be charged to receive the COVID vaccine. That has been that's built into the agreements that people sign related to kind of the federal agreements to receive vaccine, because everybody is receiving the vaccine itself at no cost. That said, it costs to administer vaccine. And so CMS at the national level has set what can be billed to insurance companies for the cost of administration, the building and the staff and the needles and what comes along with it. And just so people understand that, it's about $18 that can be billed to an insurance company for that first dose, and it's $26 for that second dose. That's for people who have Medicare, people who have Medicaid. That's the reimbursement rate that can happen for someone who is uninsured, et cetera. In addition, though, where people are seeing a provider for something that goes beyond the COVID vaccine. So if I am seeing my primary care doctor and I'm having my regular check-in and I'm getting lab work and I'm having a regular visit and I get the COVID vaccine as part of that visit, you still are able to bill for that visit, if that makes sense. So it gets complicated relatively quickly. What we have really highlighted and will continue to highlight, particularly with these urgent care centers, I think, where people are less likely to have longstanding relationships, is that we really want to make sure that if people are coming in just for a COVID vaccine, that is not a setting where we would be having charges to the individual patient. It gets into a gray line where you're starting to have more medical care. But we are pulling together the urgent cares. We're aware of it and looking at it. And again, I want people in Chicago to hear that they should not be billed directly for receiving a COVID vaccine unless they're receiving other services that are associated.
So you're talking with them, but is there any ability for you all to make some change related to that?
So, I want to just make sure that my team has had a chance to fully explore the details. There are a lot of differences here. I think where we have seen this question come up, it's mostly related to urgent cares, which tend to be more of a fee for service that then people reimburse insurance. So we are pulling those groups together, and we want to make sure that that what people are doing is appropriate in terms of what is allowed. And again, it is not a requirement that any facility be a vaccine administrator, and we will be having some more conversations with there. The health department does not regulate these facilities. We do not control them, but we do make decisions around delivering vaccine to them.
Okay, a question from Univision. Tomorrow, the city school board will vote on mandating COVID vaccinations as a condition for employment and will require teachers to disclose whether or not they've been vaccinated. Can and should employers require their employees to be vaccinated and to disclose that information?
So, boy, that is a question that goes back decades in terms of conversation. Certainly, there is precedent for employers requiring vaccination. We think about flu vaccine in healthcare settings, for example. I myself used to work at a hospital that I had to get the flu vaccine really as a matter of employment. And we also think about some of the childhood vaccines and really recognizing that although you can't mandate the vaccine itself, you can, for example, say that children need to have these vaccines to be able to be in school without a lot of extra paperwork related to it. I think the conversation remains very open related to COVID vaccine. At the moment, the available COVID vaccines are all under what's called emergency use authorization from the FDA. My sense is that as these vaccines likely get that more full authorization from the FDA, we will see more conversations like this. I am supportive of being able to understand whether people have been vaccinated. I think that is important, and I am certainly supportive of employers exploring these possibilities. We are going to see what the next 6 months bring. I think while vaccine remains limited, it is difficult to be mandating at this time. But when we get to a point where the vaccine has been fully authorized for use, if the safety and the efficacy remain as fantastic as everything that we have seen to date, and it has been made widely available to employers, I think we will see settings where not just employers, but potentially, travelers. We're already hearing about international airlines that are starting to look for vaccine. It's going to be a conversation over the next 6 months. I'm glad to hear that there are already conversations happening, and I do think the ability to have vaccination records at a minimum is a very important place to start.
As part of that, briefly too, is there fear that people might be worried about losing their job should they still have skepticism and not be getting the vaccine?
So I want people to get this vaccine when they feel like their questions are answered and they are confident to receive it. I do a lot of conversations with people who have questions. We welcome those questions, but the data on this vaccine keeps getting better, right? Where we've seen it now outside of the trials in full use, performing with fantastic safety and protectiveness. So really my hope, and this is learned over years of conversations with about flu vaccines and others, is that people will choose to get that vaccine because it is what is most protective for themselves, their families, and the community. I do not see a setting where the city of Chicago would say all Chicago residents, you need to be vaccinated. I do not see that coming at any point, just to be very clear. But I do think we may see settings down the line where we may see businesses or others centers decide to make that part of their practices, and it's going to be a major space to really watch over the next months to come.
I have one last question from Block Club. They were asking about the Hermosa residents in 60639. They're saying that they weren't able to get vaccinated at the Protect Chicago Plus Belmont Cragen site, so they're wondering, Hermosa is a community in deep need also of response, so what is being done for that community specifically?
Sure. So again, when we use the Chicago COVID Vulnerability Index, we ranked all of those communities, 1 through 77, and we do not, we get this question a lot, those 15 Protect Chicago Plus communities are the ones that are getting the most intensive investments right now, but anybody, and that would include Hermosa, any of the communities that are in what we call a high COVID vulnerability index are also being prioritized related to how we direct vaccine, how we think about where are we first going to senior centers, where are we first bringing efforts. And the idea is that these first 15 is what operationally we're able to do during this 1B phase, really rolling it in over March and over April. We look every single day at our zip code data, and yes, Hermosa is also part of 60639, and 60639 is doing much, much better as a result of these investments. So I really want folks to hear that this is not the one and only chance to be able to get vaccine. We will keep pushing vaccine to parts of the city where we see lower vaccine uptake rates. And I'm glad that there's been such a lot of interest in the Protect Chicago Plus and making sure that we can direct vaccine where it's most needed. But we'll keep doing that based on what we see on data related to vaccine uptake as we move further ahead, and getting more resources from the federal government, and especially more vaccine. Vaccine is the thing that is at this point really holding us back from being able to do more. So we're planning ahead, for months here, and people are not being left out of that planning even now.
Okay, thank you.
Thank you.